What's up, YouTube? Welcome to my channel. Today we'll be explaining to y'all what sickle cell is and like stuff that can happen if you have sickle cell or how you can get sickle cell and stuff like that. And this is my nurse. He had sickle cell before, but he had the cure. And then she is
a student. Her name is Natalie.
Yeah. So we'll be explaining what sickle cell is and stuff like that. I had him do the video with me because he knows more about it than me, and he has sickle cell, so he definitely would know more about it. And he had the cure, so that's more things that y'all could learn about it. So is there anything that you want to start off with?
Yeah. So my name is Paul. I am a registered nurse at Mott Children's Hospital. I myself used to have sickle cell. Had a bone marrow transplant in 2019 to get rid of it. It's not an easy journey, not easy journey at all. But to explain what sickle cell is, let me go ahead and just explain. Yeah, so sickle cell is a blood disease. It's not something that you can catch from other people, but you can catch it from family. But by catch, I mean, it's not like a cough and cold, how you catch a cold. It's something that's inherited. So sickle cell is a recessive gene, and both mom and dad essentially have to have the trait. If they both have the trait, it's very likely that one of the kids down the line have sickle cell. And Keyshawn and me were the ones that lucked out. So what sickle cell is, it's basically when your bone marrow, which is what makes your blood. So anyway, so your bone marrow in your body, that's what makes your blood cells, right? And when someone that has sickle cell, the bone marrow, it makes sickled shaped cells and like crescent moon shaped cells, right? And when too many of those cells get close together, they clink on together, and it somewhat causes a clot, and that area where they catch on together, that tissue around it gets deprived of oxygen. And that's what causes the pain. And sickle cell is known for having immense pain. Now, there are other symptoms of sickle cell, but the main one is pain. There are other symptoms like stroke, something called acute chest syndrome, which basically makes it feel like pressure on your chest, or it's hard to breathe. It can potentially cause I believe seizures. It's never happened to me though.
I thought it was just strokes. I didn't know you could have seizures with sickle cell. I thought it was just strokes.
I could be mistaken about seizures, but definitely strokes for sure.
Yeah.
Those are the main things that can happen. And most of the time, the people that come in for the pain treatment, they get what's called a PCA pump, or patient-controlled analgesic, which is just fancy words for the patient here is the captain of their own pain. So there'll be like a little button, and every time Keyshawn here feels pain, which is gonna be constantly because of the sickle cell, he pushes that button and it gives him some type of relief. And then there's other pain measures that we go through, like hot packs, cold packs, warm blankets. Heat helps the most, but some people like the cold. That's not me. I'm assuming it's not you either.
Yeah, I don't like cold.
But many of the sickle cell patients that I've met, they like their rooms warm, because cold can be a trigger for pain, or just like weather changes in general can be a trigger for pain, or for a flare up, if you will. Another trigger or common trigger is getting on a flight, flying somewhere. There have been many times throughout my life before I took a flight, I had a blood transfusion first before I hop on the flight. Now, the reason why we do the blood transfusions is because what sickle cell does as well is that it makes your hemoglobin level low. Your hemoglobin is something that's in your blood that carries oxygen, right? And if your hemoglobin level is too low, your oxygen level is going to be low. So that's why we do blood transfusions. They also can kind of get rid of some of the sickle cells out the way, because what is also very common, we do what's called a partial transfusion. So we'll pull some blood off, we'll get some of those sickled cells off, and we'll do new blood. And that also kind of helps with symptoms. It morally kind of helps with energy. It doesn't really make pain go away, essentially. But it can help boost that hemoglobin level, help boost that oxygen level, and make for a more comfortable stay, essentially, or a more comfortable experience. Again, patient's not going to feel better all of a sudden with a blood exchange, blood transfusion. Not immediately, anyway, not like pain meds, but it does help down the line. Symptoms wise, there's not much else I can think of. There are different types of sickle cell. The two main types are called SS and SC, which are fancy letters for one can have worse symptoms than the other.
I seen so when I was going live on my t-shirt page on Instagram and TikTok, it was a bunch of people asking me, like, making comments saying do I have SS or SC, and I had no clue on what they were talking about. I thought they were just talking about like sickle cell, or I don't know what SS meant, but I still never knew what SS or SC meant.
Oh, that just SS and SC is just the type of sickle cell that you have. I'm gonna assume you have SS. It might be in your chart. You can get that later if you want. I had SS as well. SS is the more severe one, and it just can cause more pain. But some people, not all people, but some people that have sickle cell, they can live their whole lives symptom-free, right? They don't have any pain, whereas others they're frequent flyers, they're in the hospital all the time because there's just so much pain. And one huge stigma about pain, like doctors, nurses, everywhere, they always want it to be measurable, something that they can measure, right? They want to see a blood pressure level go up, because when you're in pain, sometimes your blood pressure can go up. Does it happen all the time? No. Or they want to see an increased heart rate, because pain can cause anxiety, which causes your heart rate to go up. But that doesn't always happen when you're in pain. Sometimes you can have a very high pain level and your blood pressure or heart rate can't budge, right? And because doctors or some nurses, they don't see something that's measurable, they think, not saying that this is you, I'm just speaking in general, they think like, oh, well, this happened to me, I'm speaking for myself. They're like, oh, well, this patient is just seeking meds, right? They just want pain meds. When that's not the case. I've had plenty of arguments myself with doctors saying like, oh, you're just here for the pain meds. I'm like, no, I'm not. I want to be here. I don't even like the pain meds. They make me itchy. I can't poop. Other stuff like that, okay? Because they make you constipated. Well, that's what the pain meds do. They make you constipated. I
don't like taking all the constipation medicine and stuff like that.
They're not fun.
Make me sleepy.
Yeah. And I've had amazing, most of them have been like very amazing doctors, very amazing nurses that have been super understanding. But because pain isn't always measurable, that's why you might get, or sickle cell patients might get accused here and there, right? Me personally, since I know what it's been like, if someone tells me that they're in pain, I'm going to 100% believe them every single time, right? Because what some people think also is that just because you're asleep does not mean that you're not in pain. That just means that you're so used to this certain level of pain that you've managed to be exhausted enough to go to sleep. But you can still very much be asleep and be in pain at the same time. Because at the same time, I've also had a doctor come in my room while I was asleep, change my settings while I was asleep. I woke up, I'm like, why is my button not working? And they're like, oh, because you were asleep. I'm like, the pain didn't go away, I was just asleep. That happens, I'm assuming, can happen a lot of time in many hospitals. But yes, pain is something that we here and I'm assuming many other health institutions try our best to control. That's why we're trying a bunch of different things. Like, for example, with Keyshawn here, he has 2 PCA pumps just because his pain is not being helped right now. So we're doing our best to try to control it. But pain can't always be as easily treated as other things, because pain can be intermittent, it can be continuous, it can be both at times. It can move from place to place. My own personal experience, whenever I had a sickle cell pain crisis, the pain would be at the same spot every single time without a doubt, right? Some people might not experience that. I've noticed with Keyshawn here, it seems to have been in the same spot when he comes in. But some people, it might be in different places. right? But it's very, very common too for it to be the same spot every single time. Yeah, another common thing I don't think I've told you this yet, because you're very truthful with me about your pain, but some of our teenage patients that are in pain, I tell them don't be a hero, because what a lot of patients tend to do, especially teenage boys in particular, they'll write off their pain. They're like, oh, well, I don't want to bother the nurse, or oh, I don't want to get extra payment, so I'm just going to sit here in pain with no relief. Why? You're just gonna extend your stay for no longer. I'm not gonna lie, I've done this plenty of times in the past. Even my nurses got used to it. They would ask me, what's your pain level? I said, oh, maybe a 5. And then she asked me again, she's like, okay, what's your real level? I'm like, okay, maybe an 8. I couldn't tell you why I did that, I just did that. But don't do that. For anyone that's watching this video, if you have sickle cell, don't lie about your pain. Tell them about your pain, tell them where it's at, how it's hurting, tell them when it gets better, because that tells us, okay, what we're doing right now is working. Tell us if it gets worse, because that tells us, oh, this is not getting better. And then we'll tweak treatment as needed. And that's what we're doing here. We just now tweak the treatment because we don't right now have Keyshawn's pain under control, and that's what we want it to be. We want it to be under control, because the more it's not controlled, the more time he's missing from school and whatever else he has going on at home, right?
Yeah.
So we want to be able to make sure that Keyshawn can eventually, hopefully soon, go home and get back to his normal life versus being here all the time. So, yeah.
All right. So you explained what sickle cell is. One more thing that I want to talk about before we end the video. I just had it in my mind. What was I gonna say? What was like your longest or like worst like hospital stay, or like either longest or worst hospital stay?
Okay.
After you go, then I'm gonna go. Or do you want me to go first?
You go ahead.
All right. So my worst and longest one was, I think I was either in 4th or 5th grade, but I know it was in elementary. So it was around my birthday time, and it was actually my birthday month. And I got in the hospital like a month before my birthday, and I was in the hospital for 4 months straight. That's what my mom told me. So I even spent my birthday in the hospital. So I would say that was my worst one, because I didn't want to spend my birthday in the hospital. I spent like probably 3 holidays in the hospital before. My birthday, Easter, and I think I was in here for Thanksgiving once. I'm not sure, but I know it was birthday and Easter.
Mm-hmm.
Easter was this year. Birthday was like in 4th or 5th grade. But I would say that was my worst one, because I don't want to spend my birthday in the hospital. And then it was like sad seeing everybody had to come to the hospital to see me in pain on my birthday, and then it made me sad to see my parents have to watch me go through this. So that was probably my worst pain crisis and worst worst one that I've been in.
That's heavy. That's tough. My worst stay or longest stay ever.
All right, sorry y'all. My storage was full, so I had to delete some videos. So now I got storage, and he could finish telling us what was his worst or longest stay.
My worst and or longest stay, it was when I was here for transplant, so that's not super sickle cell related, so I'm gonna stick to the sickle cell longest stay. That stay was about almost a month, so I've not been here not nearly as long as Keyshawn is for sickle cell specifically. And that stay was primarily just pain and acute chest syndrome. So I was having a really, really hard time breathing. And I was just in so much pain, it was crazy. And just nothing was working. Like my usual pain meds were not working. And eventually, in that month-ish span, then I was okay enough to go home. Like the acute chest syndrome, that was resolved, and then I went home on a pain medicine regimen, which basically means they gave me pain meds to take home. They give me a certain amount, and I take a certain amount every single day. Because with pain meds, you can't just stop them cold turkey. You have to wean down, or like start with this dose and slowly go down to a lower dose until you're done. Otherwise, you'll go through what's called withdrawal from the pain meds because your body is used to it. And we don't want that. That's just not fun. So that was my longest day. Just primarily pain, can't breathe. Nothing big. No, that's serious. I'm just joking. But yeah, that was my longest day.
And something I forgot to, I had accidentally left out on mine was when I was in the hospital. I was in the hospital for so long, and I was like super young. So my parents weren't like hard on me about like, get out the bed and go walk around. So I was laying in the bed so much because I was in pain. Like my usual spot is my legs. So I was in pain in my legs for so much, and I was like laying in my bed for the full couple months. And it was at one point where when I had got up and tried to walk, I couldn't walk. So I had to go through a couple months of like physical therapy to like learn how to walk again. And it was just painful, like because my mom, she had shown me some videos of me like learning how to try to walk again, and it was just painful trying to watch me learn how to walk again. Like I don't ever want to go through that again. That's why every day I like encourage myself to get up and either walk to the playroom or like just walk to sit down in one of these chairs or whatever and just like get up, because I don't want to ever have to go through that again. But yeah, that was probably like one of my worst days, having to learn how to walk again. That was just, I did not like that.
Yeah, that's happened to me before as well. My pain was always in my back, every single time. And it would get so bad to the point where I could not walk. Now, it was never as bad as how Keyshawn's has been. Because I've noticed that he like uses a wheelchair sometimes when he's here. I've never had to use a wheelchair, so I wouldn't say mine has been that bad. But usually like when it would start, like for the first day or two, I would be like hobbling or limping. My legs would feel super weak. Not that they were weak, just like the pain, it makes you feel weak in a way. So then like my knees would quite literally buckle. I'm like, whoa, I'm going down. I don't want that to happen. And then over time, yeah. So that does happen sometimes, especially because the pain is so bad. You almost can't walk. If that makes sense. Yeah.
Yeah, but that was my worst one. Just learning how to walk again and then spending my birthday in a hospital. But yeah, I don't think there's anything else that we could talk about in the video. This was almost a 20-minute video. So I think I'm gonna go ahead and wrap it up. Y'all, if y'all have any more questions about sickle cell or anything else, comment down below anything else that you guys like want us to talk about, or if you guys have any more questions about it, just leave the comments in the comment down below. So I hope y'all enjoyed the video. Don't forget to like, subscribe, and like I said, comment down below any other questions that you guys have. And I thank my nurse Paul and the student nurse Madeline for coming here and like teaching me stuff that I didn't know about sickle cell, and just like, I don't know the words for it, like just helping me learn more than I already knew about sickle cell, and helping educate y'all. For some of you that don't know what sickle cell is, now he helped you guys learn what sickle cell is and what happens, what are the symptoms and stuff like that. So thanks for watching this video. I hope you guys enjoyed, and I'll see y'all in the next video.